current situation regarding the COVID outbreak. Dr. Leslie Miller from the Bruno Hospitals Board will be giving an assessment of how this outbreak is impacting the hospital. So at this time, I hand it over to Minister Wilson for your introductions. Minister?
Thank you, Mr. Berman, and good evening. I want to start by expressing my concern with the increase of positive coronavirus cases. There's a level of complacency, and risky behavior contributing to the spread of this virus throughout our community. More and more people are not taking this seriously and not following public health guidelines and safety measures. Households are mixing without considering how easily the virus can be transmitted, and mask wearing is inconsistent. And despite the risk, people are going out in public and to events before getting their test results, and they are going out in public and going to work with actual COVID-19 symptoms. This is not acceptable behavior and adds to the uptick in positive cases that we are witnessing in our community. Bermuda has been living with COVID-19 for 18 months, and we will most likely be living with it for the foreseeable future. That is until hopefully we have established sufficient immunity for it to be in the same category as a flu or the cold. I will remind everyone of the basic precautions they must take to stop the spread of the virus. Avoid closed spaces with poor ventilation. Avoid crowded places with many people nearby and close contact settings like close range conversations. Wash your hands with soap and water frequently and use hand sanitizer when hand washing facilities are not available. 6 feet physical distancing must be maintained at all times, including during gatherings, unless you're wearing a mask. Avoid shared lunchrooms and gathering unmasked outside for your smoke breaks and things like that. Your work environment and your colleagues are not in your bubble. Masks must be worn indoors and masks must be worn outdoors where 6 feet physical distancing is not possible. This does not include while eating or drinking or participating in high-intensity exercises. Businesses should also take appropriate precautions to mitigate the risk of COVID-19 infections and outbreaks during the pandemic and to protect their employees and patrons. Every business should have a contingency plan in place in case one of their employees gets infected. We have sufficient guidance to assist, but with the large volume of cases we have now, the Ministry of Health cannot respond to the many individual requests from businesses dealing with positive outbreaks. Please visit the government portal for guidance with respect to workplace guidance for coronavirus, and that is located at gov.bm/coronavirus workplace. In addition, in view of our case numbers, remote working is strongly encouraged. Currently, there are several clusters of cases identified by the case management team at the Ministry of Health. This reflects the contagious nature of the Delta variant. At this time, our contact tracers are focused on high-risk settings, and anyone who has tested positive must do their own contact tracing. Inform close contacts and email their contact information to the Ministry of Health case management team at COVID-19 casemanagement@gov.bm. When the Ministry of Health receives your list of close contacts, letters will be sent to those identified close contacts with quarantine guidance. If you receive a close contact letter, please read it carefully. You should quarantine for 14 days and then get tested to ensure you are not still infected. The virus can incubate for up to 2 weeks. Also, please be patient with our contact tracers as they aim to contact the increased number of persons confirmed positive with COVID-19. If a friend or colleague has told you that they have tested positive and that you are a close contact, please do not wait for the contact tracer to contact you. Put yourself in quarantine. As I said earlier, the pandemic will be with us for the foreseeable future. And part of living with COVID-19 is knowing what to do when you are identified as a positive case or a close contact. There's an abundance of guidance on the government website at gov.bm. Please take the time to use the portal as a source of reliable information. Our contact tracing team, as well as our COVID-19 testing team and the MDL lab are all stretched thin and working extremely hard to manage this public health crisis. I'm grateful for their hard work, commitment, and patience. We owe them a debt of gratitude for unselfishly going above and beyond the call of duty to keep us safe and to prevent further spread. The safety of the entire island is paramount, and our public health measures are in place to protect the community. We must all do our part and take personal responsibility for our actions to reduce further transmission. In closing, the vaccine against COVID-19 is one of the single most important measures to keep our community safe. It is highly effective at preventing symptomatic disease and death. The current outbreak is primarily an outbreak of the unvaccinated. Since the start of the vaccination campaign, Bermuda has had very few serious coronavirus infections among vaccinated people, and we have had no deaths of fully vaccinated people. From July 11, 2021, when Bermuda's vaccine campaign began, to August 31st, 2021, Bermuda's COVID-19 hospitalizations and deaths of vaccinated and unvaccinated persons are as follows. Hospitalizations, including repeat admissions, totaled 133, of which 116 were not vaccinated, 12 were partially vaccinated, and 5 were fully vaccinated. There were 22 deaths, of which 19 were not vaccinated, 3 were partially vaccinated, and 0 were fully vaccinated. A primary purpose of the COVID-19 vaccines is to prevent serious illness and death, and this is what the data illustrates. To be clear, even among the partially vaccinated, those deaths could not be attributed to the vaccine. Each of us has a role to play in stopping the spread of the coronavirus. Follow public health guidelines, wear your mask indoors and outdoors, practice good hand hygiene, maintain physical distance, and download the We Health Bermuda app. Thank you.
Thank you, Minister. At this time, I invite Dr. Ayub to speak. Dr. Ayub, I believe you're on mute. All right, you may have to put on your headphones.
Can you not hear me?
Oh, yes, we can hear you now.
Okay, right. I'm trying to share my screen again. Let me know if you can see my screen. It should be the
Yes, that's
introduction
fine.
page.
Okay, it looks like there may be an issue, Dr. Ayub, with the screen share and your voice still carrying through. Let's try with the microphone and headset on. Okay, and try the screen share again.
Right. Are you able to see my screen now?
Yes, and we can hear you as well, so that's great. Okay, you can
Excellent. Okay, thank you very much. So today, just following up on what the ministers talked about, I just want to tell you a little bit more about the outbreak that we have here and let you know some of the changes we've had to put in place in contact tracing and case management. As the ministers pointed out, we are having a massive upswing in cases, and the picture you can see on your screen now is the epidemic curve, and this looks at cases since 1st of March 2020. You can see the distinct waves that we've had, the ones we had earlier on last year, the wave last around Christmas time, and the most recent one from March to May, where we had a peak that was driven primarily by the Alpha variant. As you can also see here, we have over the last month or so, we have had increase in cases, initially starting off very slow, but in the last 2 weeks, the numbers have shot up dramatically. Obviously, we're in what is called the exponential growth phase of our outbreak. This slide shows the distribution of the active cases that we have on Ireland. And you can see that virtually all age categories are involved, and worryingly, children less than 10 and adolescents up to 19 years old are also rising. But this affects all the age groups across board. This graph is a little bit redundant because we found we've got updates today, but as of 2 days ago, this is where we were at. You can see that there are younger age groups already in hospital as a result of this. So you might have heard us talk about different types of the case definitions for COVID. And I just want to spend a few minutes talking about what exactly we mean when we talk about this various terms. So for us, a confirmed case is one with a laboratory confirmed COVID-19 diagnosis, and also they would the clinical signs and symptoms points in that direction, and there is epidemiologic link to them having the disease. And for us in Bermuda, we use the PCR technique to be able to test for these cases. The next case that you may have heard is what we call the probable case, and these are cases that we have because they have that we assume are positive because there's the epidemiological link. They've been close contacts with people who turned out to be positive, and they are symptomatic. Also in this category is people who've tested positive following screening tests for and awaiting confirmation. The other bit I feel I need to talk about is the presumed confirmed case, because that's caused a little bit of confusion in the public. That is strictly a laboratory term, and that is when we find someone in a pool of tests that have turned out positive. So there's usually 8 people in a pool. If that pool tests positive, all 8 of those are presumed confirmed cases until we had the opportunity to test each one individually. So that's what that means. It does not mean that they're being confirmed and within a few hours we know whether or not they're confirmed or not. So what happens when people get told that they are positive? Well, they will be expected to have they will get a letter, as the minister pointed out. Earlier on, and there's a letter from the Office of the Chief Medical Officer, and it looks something like this. Basically, prior to you getting a letter, the first thing that should happen is your doctor should give you a call and let you know that you're positive, because all positive tests, the doctors, if you have one on record, will be notified that you are positive. At that point, when you are notified, the first thing you should do is to isolate yourself from everybody else from that point on, and also take your time to think about your close contacts over the last 2 days before your symptoms started, or 2 days from the positive test if you have those symptoms. And a close contact is a person who's been within 6 feet of you for more than 15 minutes during the day. I would like you to make a note of that and get that ready for the contact tracer to get, once the contact tracer gets in touch with you. It's also important for you to speak to your doctor about a positive test, and they will be in best position to advise you on what sort of treatments you need to take. So who's a close contact? As I mentioned earlier on, a close contact for us will be someone where you've been in contact within less than 6 feet, and you who's been exposed to a positive case within less than 6 feet for more than 15 minutes. So in a workplace setting, if you are in a lunchroom or in a meeting where you're all sat within 6 feet of each other, you'll be classed as a close contact. If you walk beside somebody during the day and you have no protective equipment on, you will be classed as a close contact. Also, if somebody accidentally sneezed or coughed at you when you're in close proximity, that will be classified as a close contact. We will not consider you a close contact if you have maintained more than 2 feet apart. If you work in separate offices, for instance, or if you only had a brief chat less than 15 minutes with masks on, or if you pass somebody on the road or in the hallway, that will not be classified as a close contact. Within a school setting as well, if you're within 2 meters of a positive person or someone in your school or class cohort test positive, and if you have physical contact such as hugging or somebody accidentally coughed and sneezed at you while you're in close proximity, those will be considered close contacts. What will not be considered close contacts is if you maintain 2 meters distance, if you go into, if you're in the same school but you're in different cohorts, and this is where we talked about classroom bubbles and the like, you would not be considered a close contact if the person is not in your bubble. If you are briefly in a room, but you kept your distance and it's less than 15 minutes, you would not be considered a close contact. But if you pass somebody very briefly through a hall, that's with adequate distance between both of you, you would not be considered a close contact. Right, so there's been, the way we manage close contacts, this diagram is a brief schematic of how we manage close contacts, and it helps us to understand how things are classified, and it looks at the risks of the COVID positive case and the vaccination status of the close contact, and whether or not the positive case was symptomatic or not symptomatic. So in the extreme cases, a positive case who's immunized, asymptomatic, and the close contact is vaccinated, the risk is actually quite low. And we tend to find this in places like people who sat within 2 rows of each other on a flight, for instance, where everybody's masked throughout. The other extreme is when you have a positive case who isn't immunized, symptomatic, and their close contact is not immunized as well. The risk is actually quite high. And there are various grades in between that. Because of the sheer number of cases that we are at the moment, it isn't possible for us to contact trace every single case. In some cases, we have some cases with as many as 80 contacts. It's simply not possible for us to contact trace everybody at the moment, and therefore we are appealing to everyone in the community to take a bit of personal responsibility in getting their contact tracers, their contacts, and the details of their contacts. And we will be contacting them, as the minister said, by letter with the instructions of what they need to do. Having said that, though, there will be priorities for us to test, and the priorities for us that we'll be chasing. And those priorities include healthcare or health facilities, people in congregate living facilities such as corrections, nursing homes, shelters, and group homes. Other congregate settings like daycare facilities, schools, and colleges. If we think there's exposure happened in a large event like a wedding or funeral, and if the exposure is in a critical, national critical service, such as public works, and other essential workers like the police, fire, customs. So I have shared this slide before, but I think it's important to re-emphasize this. This again is building up on what the minister talked about. There is no single thing that you can do that will give you 100% protection against COVID. However, if we layer up our protection, we will be able to give ourselves the best possible chance of fighting this virus. The most important thing you can do as an individual to protect yourself is to get vaccinated. And also, if people who've tested positive, it's important that they isolate and quarantine all their close contacts. It's important for us also to have properly ventilated venues with good air filtrations. It's important for us to have a sensitive and fast contact tracing system that we'll put in place. If you ever find yourself in a crowded setting, please limit your time. Remember, the longer you stay in a crowded setting, the more your chance of getting infected. Again, avoid touching your face if possible. Have very good hand etiquette. Wash your hands with soap and water for 20 minutes each time. And when there's no hand washing facilities available, sanitize your hands as frequently as possible. Cough into your sleeves and into your elbows rather than into your hands. Make sure you wear masks. That protects you and protects other people around you. Maintain physical distancing at all times. And if you're sick, I cannot emphasize this enough. If you have sick, no matter how mild the symptoms are, please stay home. So thank you very much.
Thank you, Dr. Ayu. And now I welcome Dr. Miller to share his remarks.
Good afternoon. I'll certainly echo the remarks from Dr. Ayo, and thank you, Dr. Ayo, for that excellent presentation. And I would certainly urge people that even at this late stage, they should go out and get their vaccine. When we look at the numbers in hospital in the initial group which we had in April, there were very few people who had even one vaccine. And certainly the important point is that even at this stage, we have not had a single death in the fully vaccinated group. And that's very important, because as it happens now, there will be others who will say, yes, but the vaccinated people can get the infection. In practice, they tend not to be very ill, and the few who come in tend to spend very little time in hospital. In the worst case scenario, so far, we're aware of only one fully vaccinated patient of the many who have gone to the intensive care unit. And in terms of the people who have been fully vaccinated and admitted, again, there are very few, and they do well, much better than those who have not been vaccinated. The present outbreak is posing a challenge for us at the BHP, both at King Edward as well as the MWI. And at King Edward in particular, it has forced us to have a suspension of elective surgery and also some cutback in outpatient activity. This is to allow us to use the nurses in the OR to help to man critical services because what is not often recognized is that when a patient goes to the intensive care, they now tend to require one-on-one nursing 24/7. And it's not just a question of using up resources, but it's a question of having enough staff to provide the care on a sustained basis, because the intensive care patient is likely to remain in the unit for several weeks. And it therefore also means that there's a constraint on others being able to get into the unit if they're very ill. So that there should never be the assumption that, oh, I will come, and even if I go to intensive care, I'll be there for a day or two and go back home. That's not the story at all. And even among those who initially we do not admit to the intensive care unit, some do deteriorate and may have to be transferred to the intensive care unit, sometimes for a brief period, other times for several weeks. At the present time, we have a challenge where, contrary to the notion of others who think that COVID is just like the flu or it is something simple, we're now seeing an increased number coming through the emergency department. That has placed pressure on the staffing, and part of the reason for reduction in outpatient surgery was not just because of the bed situation, but also we needed to have the nurses and other staff to be redeployed to other areas. And we have been redeploying some of these to help out in the emergency department. But in the best of times, beds tend to be a challenge, and certainly it is at the moment. And the take home from that would be to say to people, go and get vaccinated. It's not too late, because very few will come in. The other side of it is that we wish to say to others who have other serious illnesses, we're still open for business. So if you're seriously ill, then certainly you should come in. If it is thought to be COVID, it makes good sense to call ahead, because it makes for a more streamlined process. With the rising numbers today, we have decided to put up our emergency tent. The purpose of that is not to house patients, but to allow for a more streamlined assessment. Some of the COVID patients will be stable enough to go home, but others we will have to admit. So the quicker we can do a streamlined assessment, the better. And so for that reason, we have decided to put up the tent. In addition, we can reassure the public that we have enough respirators. That's not our challenge. We have oxygen. That's not our challenge. And we have made preparations of opening a satellite ICU, which we are currently using. And in addition to that, I gave instructions today for a second satellite to be opened, and that is opened and it is ready in the event we have to use it. So therefore, there's some reassurance that we have preparations and we have resources, but personnel will get tired. There's also the risk that because our staff live in the community, they too may well get ill. And it means that going forward, we could have staffing challenges if more and more people were to get ill. Again, the best way of preventing that is, in addition to maintaining social distance, good hand hygiene, is to encourage others to get vaccinated because our own local data shows that it does work. Even if it doesn't prevent infection, it reduces the chance of you transmitting the infection to somebody else. And importantly, it reduces the chance of serious illness or death. We certainly have to bear in mind the challenges with quarantined staff and the challenges that some of our staff will have because their children or their spouses may be quarantined. So it is a complex thing. The PHB is part of the community and as such will be affected by things in the community. We are grateful for the support and the assistance of the Ministry of Health and the Public Service, Dr. Ayo, in assisting us to have a smooth operation and to keep things running quite well. To those members of the public who behave responsibly, we thank them and we appreciate them. To the many businesses that have also helped us in various ways, including with our vaccination program, we wish to thank them. But one final message is to say to the others who are on the fence, it's not too late, go out and get vaccinated. It is your best chance of staying out of hospital.
Thank you very much, Dr. Miller. At this time, we will take questions from the media, starting with Diane Brewer from BBC. Diane?
Oh, good afternoon. Yes, Diane Brewer, Bermuda Broadcasting.
Yeah, Diane, if you can please mute your other video source.
No, thank you very much. So my first question for Minister Wilson, please. Based on the rapid rise in cases and hospitalizations, what will trigger another stay-at-home order? What is the criteria?
Minister, you're mute.
Minister, you're on mute.
Thank you. I apologize. Diane, those are constant conversations that we have internally within the ministry as well as the cabinet subcommittee, COVID subcommittee, and the cabinet generally. And we do have those conversations quite regularly. You can appreciate that a large portion of our Tuesday cabinet meeting does surround COVID and looking at the current data and what steps, if any, need to be taken to address it. Again, we do meet regularly. We are monitoring the situation. Our hope is to try to encourage persons to be responsible and to adhere to our public health guidelines that we've spoken about actually for the last 18 months so that we can try to avoid such a drastic measure as a lockdown, which of course will have all kinds of trickle-down adverse effects on persons' employment status and the like. So we are hoping that we will not have to utilize that as a avenue for addressing this current outbreak. However, we are, again, just imploring members of the public to take personal responsibility and to ensure that they adhere to the public health guidelines so that we can minimize the further transmission of this very, very contagious Delta variant.
Thank you, Minister. For the Chief Medical Officer, could I ask, why has the Ministry of Health and the Ministry of Education not acquired and distributed rapid COVID antigen tests so that parents can test their children in the days leading up to school and in the morning before sending them off to school? Rapid testing has been used successfully in the UK for over a year. Why not in Bermuda as an additional tool to the much slower PCR testing?
Thank you for that, Diane. Actually, the rapid test is best utilized for symptomatic people. It's that's when it comes to its own. As a screening test, which is what you are asking for, the intensity of screening that you need to do is actually much more than. So you need to test 2 to 3 times every week before you can rely on that for for it for diagnosis. So that actually is inferior to what we have on island. The saliva testing, PCR testing is actually superior, is more sensitive to that. That would work. And I'll just use this opportunity to tell parents who are yet to give consent for their children and their wards to get tested. Please go ahead and do that. That not only protects your child, it protects all the other children in the school, and means that we can keep schools open for as long as possible and encourage face-to-face learning.
Thank you, Dr. Ayo. Another question for you, please. The elderly, the vulnerable, and our frontline healthcare workers were the first, of course, to be offered the vaccines back in January. The early adopters will need a booster shot sooner than others. Why have we not offered boosters to these people? You can walk in the U.S. right now and get one without any question. Why not here in Bermuda?
Well, the science is still emerging on this. So there's quite a lot of studies that are going on that we're closely following. And it's not quite clear yet on the extent of booster shots that should be offered. What is clear and what there's actually not controversial is that people who have weakened immune system for whatever reasons need a booster shot. For healthy people, it takes a bit more. There's a little bit more nuance, and is that nuance that we're considering. The Bermuda Advisory Council on Immunization Practices is looking at this and will give advice to the government very soon.
Diane,
Yeah.
I'm going to let you have another question. Just so you know, the minister does have another engagement in 5 minutes. So I'm going to let you have one more, bring on Jonathan, and if you want, you can stay and then come on after Jonathan is finished. Okay, so go ahead.
Thank you. To what extent are the public anti-vaxxers undermining efforts to reach herd immunity for the island?
Is that for me or for the minister?
I guess whoever would be happy to answer that. Probably both. But,
Minister, I'll go after you.
Okay, thank you. We have seen in many jurisdictions, not just in Bermuda, Diane, basically a soft ceiling where those persons that were keen to be immunized obviously got to raise their hand and got in line, rolled up their sleeves quite quickly. And then there's still persons that were potentially on the fence. So there's the next phase. And now there's a group of individuals that for a myriad of reasons have decided not to become immunized. What the government is committed to is twofold. One is to continue educating members of the public about the importance of vaccination, as well as encouraging them to exercise their choice and to speak to their doctors and rely on reliable sources with respect to educating themselves concerning it. And then secondly, as we've maintained previously all along, that we will ensure that we have sufficient supply of vaccines for all persons that wish to undertake the vaccine for their own benefit, first and foremost, and those also for the benefit of the community.
Thank you very much.
Thank you.
All right, Dr. Ayo, anything to add?
No, I was just going to say that vaccine hesitancy is nothing new. 200 years ago, when we first vaccines were being used for smallpox, we had people who are hesitant to that. So it's nothing new. I suppose what is new is that when there is a wealth of trusted information available, people still choose to follow untrusted sources. As the minister said, what we will continue to do is to provide reliable, trusted information to enable people make an informed choice to get vaccinated and make sure that those vaccines are available once there's demand for it.
Okay, thank you very much. All right, Diane, I'm going to put you back into the waiting room and let Jonathan come out and have a chance before the minister has to depart us. Okay, Jonathan, good afternoon. You're live.
Good afternoon, folks. Am I here?
Yep. You can
Everyone
go
can
ahead
hear
and
me?
ask your questions.
All right, thanks. Jonathan Bell from the Gazette. I guess the first question that I had, are we looking, do you consider this a fourth wave?
Reluctantly, yes, Jonathan. We are considering this a fourth wave, yes. You would have
Got
seen
it.
the graph that the CMO showed with respect to the spike. So yeah, we are in a fourth wave.
It looked like that. With that in mind, are we looking at perhaps restrictions such as a broader use of safe key, perhaps cutting down on large group exemptions? Are there further steps that we're going to take in that direction to try and arrest it?
Jonathan, like I was saying to Diane, those are conversations that we continuously have at the cabinet table. One of the parts of the discussion that I can relate specifically to continuation of the use of safe key, and we are encouraging persons to use that. And all large group exemptions that were previously granted will now be required to ensure that they implement safe key. And when we say implement safe key, it's not only is it important for persons to obviously have their safe key, but whoever is basically the host of the event has a duty to ensure that they upload the app and check the safe keys, not just looking at the barcode when the person the QR code when the person walks in, but measure the QR code with the app so that they see the little green tick, and then of course measure the QR code with the identification of the person. So there's a number of steps that have to be taken by the person that is like the operator of the facility that's using the safe key, but it's a very, very quick and painless exercise. And the benefits far outweigh the 30 seconds of inconvenience of using your computer, your phone to confirm that person's safe key is valid.
I guess an open question here, but it would be interesting to hear about what kind of clusters we're seeing, what size they are, what scenarios they involve. You mentioned people have gone to work when they perhaps shouldn't have. What are you able to tell us? How many clusters are we seeing, and what kinds of clusters are we seeing?
Well, when we're in community transmission like we're in, obviously it's very difficult to identify the number of clusters because obviously the number of cases far exceed us, the ability for us to be able to track down all the clusters. But what we are seeing, and which is really, really of concern, is that people are going to work ill. People are having symptoms, people are getting tested, not waiting for their test results and still going to social activities and or work. And then, of course, transmitting the virus to other individuals. We're seeing schools and nursery schools, camps, where children are being impacted and contracting COVID. Obviously, many of those circumstances, as the CMO would have showed in his slide, involve children that are unable to get immunized because of their age. So there's a number of factors that are contributing to the spread that we're seeing, but principally, as the data shows, actually 70% of the community transmission is from unvaccinated to unvaccinated.
Thank you, Minister. Jonathan, if you do have any further questions with yourself and Diane, you can email them to me or the minister anyway. She had another engagement to depart to. Dr. Miller and Dr. Ayo will stay on and answer any further questions that they can address. So, Minister, thank you very much for your time.
Yes. Okay. Thank you, everyone. What is this? The clarification.
I guess what happens now? Do I pose questions to others, Mike, or do you want me to just wait here?
Yeah, you can go ahead and ask questions to the doctors.
I'll keep this quick as I can, folks. Okay. Obviously, it's early days. Are we anticipating, well, in terms of a surge in hospital, when are we going to know? Are we anticipating a surge in numbers there in, say, a week's time? Are you able to give us any kind of indication on when that might be?
Well, Jonathan, we are in fact seeing a surge in hospital at the moment, and we expected that. There's no indication that we're near any peak, and so we have rising numbers. We have opened our satellite ICU, which is partly occupied, and based on the projections, I also gave instructions to open a second satellite ICU today. So we have the main ICU and 2 satellite ICU available, one of which is being used at the moment and the other is ready.
keeping in mind we're talking about a highly unlikely scenario, but in the event, obviously all we hear is that we want to avoid the hospital getting overwhelmed. What recourse do we have if we come to a point where the hospital is seeing too many numbers to deal with? What do we do from there? Do we send non-COVID patients overseas? Can you walk us through some of the plans in that scenario?
Well, there are a number of things, because what happens is that there is a kind of triad system. So at the present time, we do not admit every COVID patient that turns up to the hospital. If they turn up, they're breathing well, their saturation is fine, they have no major underlying problem, then those patients will go home and will self-monitor, and they will be given particular instructions with the understanding that they can call or they can come back, and they would be able to monitor their oxygen saturation as well. So at the present time, we do not admit everyone. This week, it can be put off for next month or so. We have taken that action of suspending elective surgery with the plan to reschedule them when we are in the certain phase that things are more quiet. So we are marshaling our resources, and we would be continuing that process. So it's unlikely that we would get overwhelmed with acute cases. We also have plans to open up more beds if we have more admissions. So we have a certain flex capacity to do that.
All right, Jonathan, I'm gonna let you have 2 more questions and then turn it back over to Diane for.
All right, thanks, Mike. We have been informed that one of those in hospital is a toddler. Is it possible to get any ages for those in hospital? A range of ages is certainly fine. And perhaps the ages of the 2 people who have we've recently lost?
For the reasons of privacy, we can't comment when there is 1 or 2 individuals, because they will be too easily identified. But suffice it to say that this time around, we're seeing more younger patients than on the previous occasion in March and April.
People in their 30s, so yeah.
Yeah, you know, and some of them are people who did not have significant underlying comorbidities. So the misconception that people have, well, I'm not diabetic, I'm healthy, I'm all right, I'm in my 30s, I'll be fine. That isn't necessarily true, and that is being played out now.
I guess the final question I have is, and we bring this up a lot, I know, but I've heard it over and over here that really the best way to protect yourself is to get vaccinated. Is there any kind of encouragement in training for maybe some of these younger folks to avail themselves? People who thought, you know, if I get it, it's not going to be anything serious. Can you talk to
Yes,
any?
You're quite right, Jonathan. The best protection is vaccination. And the uptake in the younger people has been slow, but there are encouraging signs, because as I walk through, I tell the story of 2 weeks ago. I was passing on a Thursday the old emergency department. A young lady called out to me, and I recognized the voice. And that it would affect your children, and all the many different stories. So those are there working, convincing their peers. So it's happening slowly, nowhere near the pace that I would like, but it's not all gloom and doom.
All right, thank you, Jonathan, and have a good evening.
You too. Thanks.
Okay, I'm going to bring back on Diane Brewer. All right, Diane, you are live. Go back on the line. You can mute your other video device.
I will. Thank you. Thank you so much. So for the Chief Medical Officer, Dr. Ayo, given that about a third of the population is unvaccinated and people in Bermuda are still dying from COVID, why has the Ministry of Health not set up a monoclonal antibody infusion center to help COVID positive persons before they end up in the hospital?
Okay, that's a very interesting question. There are several layers to it. So first of all, the monoclonal antibodies is even more experimental, using the words of the COVID people who have doubts about the vaccine than the vaccine. But crucially, is by far more expensive way of doing it, in order of several tens of thousands of times more expensive compared to vaccination. In addition to that, it's only very recently that this vaccine is, these monoclonal antibodies have been available for sale outside the US. For a long time, there was a moratorium on export of this vaccine. So we couldn't even get it if we wanted it. So why would you spend hundreds of thousands of dollars on a drug that would benefit a few people when for the same amount of money you can cover thousands of people?
In my home state of Florida, they have about 20 plus walk-in centers where they seem to be using the monoclonal antibodies quite profusely and just in a walk-in basis. So
at a significant cost to the health system.
Right.
And if I may add that, and the challenge is that they're using it, but the indications are not clear. So it's like if I'm giving Tylenol to everybody in town to prevent pain, but I really don't know how many of them would have pain anyhow.
Okay, thank you. And just as far as an update, I don't think I've actually heard, but what's the current status of vaccine supplies and what vaccine is currently on island being used?
Okay, we still have quite a sizable supply of Pfizer BioNTech vaccines available for use on island, and those are the ones that have been given to us by the UK government. We have a commitment from the UK government to continue to supply the vaccines that we need, but crucially, we need to demonstrate demand. As Dr. Miller pointed out earlier on, we do still have increased demand, but it is going at a glacial speed. So there's no point getting vaccines here if they're going to end up being wasted. There are parts of the world where access to vaccines is not even, there's no access to vaccines. So we will have enough vaccines for everybody who wants one, but we will not be wasting vaccines.
Thank you, Dr. Ayo. As an adjunct to that, I mean, have you seen an uptick in vaccinations as a result of the FDA's approval of the Pfizer vaccine, and also the recent jump in positive cases? That certainly has spurred people in other countries to increase their vaccination levels.
Yep, we have seen a slight increase when the week after the FDA full approval for the Pfizer BioNTech vaccine was given. So that there was a slight increase in, I think the numbers was a doubling of registrations that week. But since then, it sort of plateaued. We're seeing roughly about 150 new first doses every week. But that's a far cry from the heady days of doing 800 doses a day. We will still like more people to get vaccinated. As I said earlier on, that is the single most important thing you can do for yourself as an individual to protect yourself from this virus.
All right, Diane, you have one more question?
Okay, thank you. Okay, so finally, again, for the Chief Medical Officer, Dr. Ayo. Dr. Ayo, as the Chief Medical Officer, do you have the authority to recommend a COVID circuit breaker to help further slow the spread of COVID?
Yes, I do have the authority to recommend what I think is necessary, but those decisions are for the cabinet to make. I don't have the authority. I have the authority to recommend, but I don't have the authority to implement.
Thank you very much.
All right, thank you very much, Diane. All right, Dr. Miller and Dr. Ayo, do you have any closing remarks?
Certainly, I must thank everyone and thank Diane and Dr. Ayo and the Ministry of Health, and also my team here at the BHP who have been working hard night and day to put things in place to make sure that we can handle the surge and the increased numbers that we anticipate. Like Dr. Ayo, I would like to stress for the public that their best bet is still to go out and get the vaccine. It is still available and it is free. In terms of other things which they may hear, if they now watch the press, they will see that the story of ivermectin, which some people sadly still use, has no place in the management of COVID. And in fact, in the United States, it certainly has caused very serious problems in large cities and in many communities. So I would urge people not to go down that route. In terms of the newer concept like the monoclonal antibodies, it's not an alternative to the vaccine. It's not as effective as the vaccines. And in fact, I would echo Dr. Ayo's word that indeed you would have to, at this point in time, regard it as being experimental. So my closing remark would be to appeal to the public that they should maintain social distancing, wear their masks, and also, most important, for those sitting on the fence, go out and have their vaccines.
Thank you very much, Dr. Miller. I would echo everything you've said very strongly. The final thing I'd like to say is that to everybody who's been spending the time and doing the right thing, I want to say thank you. Your efforts have not gone unappreciated. And for those who are still challenging what is being said, please speak to trusted health sources and find out what is good for you, and do that, please. The final point I'd like to make is I want to say thank you to everybody who's stopped me and my colleagues on the street to say thank you for the work that we're doing. And for those who feel that what we've been doing, they don't agree with everything we've been doing, please be kind. We're all working beyond and above what is expected of everybody across the hospital, across the ministry, across the laboratories. A little kindness to us will go a long way. Everybody is working at their edge now. It's not helpful when we receive verbal abuse from people, either on the phone or coming to us physically. That's not helpful. It does nothing to bring us together, and particularly those who give a lot of abuse over the internet. It's not helpful. You're not helping anybody. It's not good for Bermuda as a country. Bermuda, please come together. No matter what you believe in, no matter whether you agree with us or not, it's important that we all come together and encourage one another. You cannot doubt the sincerity of most of everybody working in health, the sincerity of our efforts in trying to tackle this very nasty virus. Please do what you have been advised to do and seek out trusted sources of information. to guide you in the decisions you make. So thank you.
Thank you, Dr. Miller and Dr. Ayo, and to the public and the media, thank you for tuning in, and everyone, have a good evening.
Thank you.